what is offered in terms of job placement and offering students a direction of where they might find positions after they graduate.
Okay. So with the CCMA, primarily this course is geared toward a physician's office type setting. So that doesn't mean just your family medical doctor. That also means the podiatrist, the cardiologist, the ophthalmologist, the nephrologist, the pulmonologist. You can work almost any doctor's office that I can think of. Okay, so the opportunities and wherever your interests are, and whatever the availability is open for you. Also, you can get employment with Inspira. Inspira seems to be interested in putting a lot of CCMAs in their physicians' offices that those physicians work for them.
Now, Inspira is a local hospital.
Inspira is a local hospital, correct, sorry. And also urgent cares, complete cares, patient first. All of those kind of things, CCMA will kind of get you in that door. The other thing that is a possibility is that if you decide that you want to keep gathering sticks, by sticks I mean venipunctures. We document the venipunctures and the phlebotomy procedures that we do because per state regulations you have to have 30 live venipuncture sticks, 10 live dermal puncture sticks to sit for the phlebotomy certification. We do all that here. But some people might want to go on to possibly just do phlebotomy to where they might want to work for LabCorp, Quest, or one of those type of places. And in which case, you know, when you get employed by that physician's office, a lot of physicians' offices will do the lab work in office. So you can continue to document your live sticks from that point on until maybe you reach about maybe roughly 100 sticks. And then the LabCorps and the Quest, they will potentially look to hire you as well because you've done a lot of sticks. So that is an opportunity for employment there. With this CET, that EKG certification that you could sit for if you would like, that will open the door to places like the Heart House, or possibly even Deborah Heart and Lung. It opens the door for many other places. Potentially, maybe even you could sometimes hospitals hire the CETs for, you know, kind of keeping an eye on the monitors and things like that on a telemetry unit. So there's a lot of different ways that you can take these certifications that you get and find that little space that feels comfortable to you. And typically, as a general rule, we will kind of, as you would, the biggest thing out there is checking on Indeed or Monster or LinkedIn or any of those places that you would ordinarily go to look for a job. We help you to utilize those. I personally, if you haven't got a resume or you don't feel comfortable with the resume that you have, I will help you to do a resume. I don't include it as part of the course, but I do that freely. If you need help with that, I don't mind. Also, I have worked with several physicians with being a registered nurse for a lot of years. I have some physicians that I've worked with that now know what I've been doing for the last several years, and when they look for help, they call me, which is great because I can send them the students that, you know, that are bright, that really strived hard and really did a really, you know, bang up job with taking the course and grade wise, hands-on wise, and all that kind of stuff. And usually if I send them, they're hired, you know. So there's a lot of different ways that we can kind of assist you in that job placement.